We're already a very integrated healthcare delivery system, and I don't mean to be boastful, but when most people come to Mayo, they scratch their head and say, we've never seen systems engineering and human factors engineering and the flow of the workforce be so effective that you can have tests in the morning, have the results in the afternoon, tomorrow afternoon see 2 or 3 more people and get out of here in 3 days with an answer. So we're pretty well refined. We've been doing this for 100 years, but if we're really going to change that and take a step function forward, I think going off onto a hilltop, as you said, to think creatively may not be the way to go, but rather how do you advance this? Because we're going to have to break the system to make this happen. Most of medical education, of course, is done in academic medical centers, and the focus of academia is to create new knowledge and advance the field. Thank goodness. We do a lot of that here. Wonderful institutions in this country and globally to do that, and we need that. But the nuts and bolts of how do you deliver that knowledge to people has really been ignored. And there are good studies that show the average patient in this country is getting last year's advice, and indeed it's worse than that. Good studies from the Institute of Medicine have shown that a scientific discovery doesn't get translated into the practice for up to 12 years after that discovery was made. And we really need to have new ways of thinking. How do we model to get those new ideas into the practice in a much, much quicker way? One of the nice things about working at Mayo Clinic is that everyone is focused on the same thing. How do you meet the needs of the patient, and how do you provide the best care to every patient every day? And that's the entire focus of the CFI, is how do we transform the way we're doing that? And I don't mean to be disrespectful to my fellow physicians, but you do something for 10 or 15 years at a time, and it's difficult to say, well, gee, where's the waste in this? And we're looking for the non-value-added activities that simply add cost, but don't benefit the patient. And just take out all the costs of that, and you have affordable care. And then if Mayo Clinic is providing outstanding care and it's more affordable, then we're accessible and we're available to people because we're connecting with them and we're relevant to them and we can help more people. So that's really that's why we're moving that direction. Mayo is a trusted voice in healthcare. It's a national treasure. It's one of the most trusted names in the business. We need to strengthen that to secure the future of the Mayo Clinic for our future patients. But it's also a business. It's a treasure, but it's a business. And I can tell you that physicians and allied health professionals don't always like to hear their organization talked about as a business. But the fact is, it is a business. And it needs to be run like a business, and it has to be successful. The difference between us and many of the for-profit businesses is that our mission is our business, and our mission is to provide care to patients. And then they relax. They say, oh, it's okay to be in a business because I am providing value to people. Now, if we're going to be successful and continue to be successful going forward and have finances to reinvest in inventing and practicing and teaching the medicine of tomorrow and doing things differently, such as the Center for Innovation, we have to be successful. And to do that, we have to do what? We have to create value.